This is Speaking of Pets podcast, where we give you up-to-date, accurate, science-based information when making decisions about your pet's health.
From experts in dermatology like my sister, surgery, internal medicine, CBD use in pets, the pet food industry, you name it. If it affects pets, we'll talk about it.
Today's Speaking of Pets podcast is sponsored by Blue Buffalo, the maker of natural pet foods. Love them like family, feed them like family. Blue Buffalo offers wholesome, meat-first recipes with high-quality natural ingredients in flavors dogs and cats love. Discover formulas for all breed sizes, life stages, and lifestyles. And with Blue Buffalo's True Blue Promise, that assures that real meat is the first ingredient, with no poultry byproducts, no corn, wheat, or soy, and no artificial flavors or preservatives. Welcome to Speaking of Pets. I'm Dr. Alice Novotny-Jeroman, a board-certified veterinary allergist and dermatologist, and
I'm Janet Novotny-King. I am not a board-certified allergist and dermatologist. I am Alice's younger sister, but I'm taller. And I'm here as the average pet owner because when she talks, I don't get it sometimes. So I have to ask a lot of questions to better understand all those medical terms, that medical jargon. So stick with us.
So listen, Janet. You need to start looking in your pet's mouths. So many people don't pay attention to their pet's mouth. They don't look in the mouth. They don't open the mouth. Big mistake.
And I think they're afraid to. I think they're afraid to.
I think they are. And I think I know Dr. Schoenberg talked about how to open a cat's mouth when she was on the show. But even if you don't open it all the way, at least try to inspect the teeth and the tongue. But anyway, we are very fortunate today because a dear friend of mine, Dr. Sharon Hoffman, who is a board-certified veterinary dentist, is with us today. She did her undergrad at Michigan State in animal husbandry, and her DVM degree is from Louisiana State. She is a diplomat, as I mentioned, of the American Veterinary Dental College, and she completed a One Health Fellowship in oral medicine from the University of Pennsylvania.
Wow.
She's owner of Veterinary Dental Consulting in Florida and on adjunct faculty at the University of Florida College of Veterinary Medicine. And she's been awarded the Gold Star Award for outstanding contributions to veterinary medicine in Florida. And I just think that's fabulous. Wow. But when she's not curing our patients' mouths, she is a photographer at Coastal Fine Photo, which we'll have a link to that at the end of the podcast. And she volunteers as the photographer for the Street Dog Coalition in Jacksonville, Florida, which we hope to have on a future podcast. But interestingly, her connection between her Coastal Fine Photo and veterinary dentistry is that a portion of the proceeds from the photography sales are donated to Make Me Smile program, which I think is a really cool program because they provide free equipment and training to shelter vets and techs so that adoptable dogs and cats can leave those shelters with squeaky clean, healthy mouths. So,
wow.
Dr. Hoffman, Sharon, if I may call you that, I just think that is a wonderful, wonderful giving back that you do. What a treat. Some of these small dogs come into these shelters and, oh my gosh, the mouth, it must be so gratifying for you to have them be crystal clean, like mwah, as they leave.
Well, it's always wonderful to put smiles back on my patients' faces.
That's a good point. The other thing is we have had so many viewer questions about oral healthcare. Janet, why don't you start? Because I hope we can cover everything.
Well, I know when we got our puppy with Libby, and our vet immediately said to me, start getting her used to, rubbing with the toothpaste, whatever it is, the veterinarian toothpaste or a brush at a young age. So is that something that pet owners should do?
Yes, it is. It's a good habit to get into. And the whole trick behind that is don't open the pet's mouth. As soon as you open the mouth, there's a struggle. They don't like that. Just lift the lip. Just put your finger under the lip and gently massage the teeth at the gum line. There's no scrubbing. There's no rubbing. You don't have to worry about the sides of the teeth against the tongue because the tongue is actually cleaning the sides of the teeth. So as you pet their faces and you pet their ears and are getting used to being touched all over, you're holding their feet so they can get used to having their claws clipped. Get them used to having your finger in their mouth and just gently massage the gums.
I will say we have 2 cats. We've had many cats. It's really hard to get them used to it.
Some cats will be more acceptable of that than others. And I do teach how to brush cats' teeth. I have, I think, 2 videos of my cats getting their teeth brushed. But I have had other cats, they're not going to allow it.
Ben loves toothpaste. You can see he would eat the whole tube of toothpaste if I let him. Well, we're going to brush his teeth, one side at a time. And you don't need to hold the mouth open. Just brush the teeth. Very good, Ben. Ben has 2 sides. We have to do the other side now, Ben. What a good boy. Good boy. Make it pleasurable. And in the end, he gets to have more toothpaste. Very good, Ben.
I watched those and I thought I learned some stuff from that too. Because I always thought, Sharon, that you had to do the inside also, but you can just do the outer side of the teeth.
Just the sides that the lips are touching.
Yes, that the lips are touching. So how do you know when a pet has a mouth problem? How can you tell that they're painful?
That's a very good question because they don't show pain the way you think they might. When a pet is having pain, so sometimes I see dogs with broken teeth and clearly I know that they're in pain because the pulp is exposed. And someone will say to me, well, they're still eating. The pet with a sore mouth, cat or dog, will still eat. And I have seen dogs with broken jaws that are still eating. So you don't want to wait for them to stop eating. Sometimes there's a bad odor. That's enough, that a sign that there's a problem. And in cats and dogs that are eating dry food, what they'll do if they have pain on one side of the mouth, they may only chew on the other. Or they may tilt the head to get away from the painful side. Or they may drop food on the floor while they're eating. So in an exam room, when there's a dog, I will often give a treat and watch them chew to see if they're avoiding one side more than the other. The other thing that they'll do is a pet will start acting old. They just act old. They don't want to play. They don't want to be social. They don't want to pick up toys they used to play with. They just act old. And when we remove the pain, they start acting younger again. So what I often tell my pet parents is we really don't know how much pain they're in until we take that pain away.
Mm-hmm. Boy, that acting old, I never thought about that. And sadly, I think there's a lot of clinical issues where people just chalk it up to, oh, he's getting old. Like you said, mouth pain, arthritis, just bellies that hurt. It's sad because, getting old is no fun, but you still do the things you can do, just less of them,
Yes.
But and that's very sad. I never even thought of that.
I think they're just not up for anything.
Yeah,
Right?
yeah.
Other than they're going to eat because they're really driven, right?
They're going
But they're
to
just
eat because it's better than starving. They're
Right.
just suffering in silence.
So sad.
So our cat once, my son said, "Mom, come here," and she had I would call it drool. She would drool coming out, and the whole side of her cheek and it was a cracked tooth, and it had to be extracted. And so they put her to sleep. Is that so? I'm assuming whenever you extract a tooth like that, you do put the pet.
The patient is under general anesthesia. Yeah.
Yeah.
And there's a lot of concerns about that. It's kind of interesting when you or I go into the dentist or an oral surgeon for surgery, we want anesthesia, but we don't want it for our pets. Yes, so general anesthesia, there's a lot of concern. There's a lot of fears about that. This is probably a good time to address that. And often the fear or the dread is based on something someone saw on the internet, or they heard a story, or they experienced a pet dying shortly after anesthesia or during anesthesia. So these are real things. And I talk to a lot of people that have that fear. And there are ways that so I'm just going to talk to you like you're in my exam room and you're concerned about the anesthesia. So there's a couple of things we do because many of my patients are elderly. They're seniors or geriatrics. It's not uncommon for them to be in their late teens, early 20s, or they have a heart problem or a kidney problem or something else that increases their risk. So the things we do to decrease risk is we do blood tests. We do them within 30 days of a procedure to see how are those kidneys? How's the liver? What's the thyroid doing? Is there anemia? We want to know what's going on in the rest of the body. And then we talk about if we find a complication, if I hear a heart murmur, I want the patient to have a cardiac evaluation with a cardiologist. So just because a patient has an illness does not mean we can't anesthetize. We want to know our risk factors because we can manage them. Some people with pets that they've had a bad experience or they have a fear, the pet may be perfectly healthy, but because of the fear, I will have a board-certified anesthesiologist working with me. And I have a team. There's actually a team. It's not just me. I'm in the mouth, the anesthesiologist is there, and I have an assistant. So we're a team to provide the safest and best care for that pet. And the pet that has a pre-existing illness or comorbidity, we can cater the anesthesia to that pet's needs. We don't use the same drugs or anesthesia protocol on all our patients. Every single one gets a customized anesthesia protocol. And then when we have a fearful pet parent, the anesthesiologist and I talk to that pet parent before the procedure to answer any questions, to let them know we are working as a team. So the patients I see are not general practice patients. I was in general practice for 20 years. I'm seeing the patients that are higher risk, that are older, that have the comorbidities, that have all these things that the general practitioner wants me to handle instead of them. Mm-hmm. It's okay. That's why I'm there. That's why I'm there. But when we're in the exam room talking to fearful pet parent as a team, what Dr. McCune, the anesthesiologist, will say, she tells them what she's going to do, and I tell them what my plan is until we get under anesthesia and I take x-rays. And guess what? Sometimes the whole plan changes. But this is how we work as a team. I'll say, this is what I have to do. And as we're working, as time goes by, I ask Dr. McCune, how is the patient? And she tells me. Or she'll ask me, how much more time do you think this is going to be? And I'll let her know. If at any time she's concerned or she can't manage the heart rate, the heart rhythm, the body temperature, the blood pressure, the respirations, any of those things, she says, you need to stop. And we can. We can stop when we're in the mouth. You can't stop if you're doing a heart surgery or an abdominal surgery. So this is how we work together as a team.
Well, and on that note, when you read about these anesthesia-free dental cleanings, that has to be bogus. I mean, how can you do a complete, thorough cleaning when the patient isn't under sedation?
And that's a really good question, because people that are fearful will seek out anesthesia-free dental cleanings. This is what I want you to remember. The least important thing that I do as a veterinary dentist is clean the teeth. The most important thing I do is the exam, which cannot be done, as you're asking, thoroughly, because I have to check what's going on under the gum, and dental x-rays cannot be taken without general anesthesia. If someone is only cleaning the teeth, even with general anesthesia, or without, and x-rays are not taken, we're going to send the pet home with very clean teeth and disease underneath the gum that hasn't been addressed. And what has happened over the years is, because of fears and other things, pets that have had anesthesia-free cleanings year after year after year, and the pet owner feels very good that they're keeping up with these cleanings and the teeth are nice and white when they go home. And several years down the road, now the teeth have to come out because the disease under the gum wasn't addressed. Wow. So it's a cosmetic procedure. It's a cosmetic. It is not a treatment of a disease. And disease goes undiagnosed and untreated.
Why is it that the smaller breeds seem to always have the bad mouths?
The smaller breeds, let's define smaller. There are
like
micro dogs that are about 2 pounds, and they come in to see me in the owner's purse. Okay, I get them that small.
Yeah.
And then, so let's define. So I'm going to say small breeds, 15 pounds and under, just for the sake of discussion. But it's true. The smaller they are, the more we see the gum disease and the periodontal disease and the tooth loss, because the size of the jaws, the bones, are quite small, but the size of the teeth in a 4-pound Yorkshire Terrier are not much different than in the 20-pound Cocker Spaniel. What's different is the size of the jaw bones. And any bone loss in the jawbone is more severe than the larger dog. That's just the anatomy. The other thing that happens is pet parents see this tiny little dog that comes in the purse, and they don't want to give it things to chew on because it's too big for my little dog. It's the same idea as giving a toddler small things, but not too small because they choke. But with a small dog, they need to chew as well. Don't break the treats into something small. They need to chew. So there's two things. It's the hygiene at home, the anatomy, the larger dogs. So now we're talking about above 15 pounds. The medium-sized dogs and the very large ones, we see more broken teeth, damaged teeth, especially our service dogs, the military dogs and the police dogs. They're breaking teeth. So I don't see them for gum disease. I see them for dental trauma or tumors. Yeah.
Do those special treats that claim to clean the teeth, do those really work?
Some of them. And there's a huge list. So we can't go over a whole list. And what's interesting, if you go into like a Walmart or a store like that,
Right.
there are more treats and foods for dogs and cats than there are for babies. Than there are
It's
for infants.
crazy.
So how
That's
does the pet owner decide what to give? Well, there's a great resource, and I think we have a link for the vohc.org, the Veterinary Oral Health Council, which is a nonprofit group. And what this group does is they evaluate the claims on the packages of these chews and treats and foods. If a chew is claiming to help with gum health or help clean the teeth, if they have submitted evidence to the VOHC and the evidence supports their claim, the VOHC awards them a seal, the VOHC seal that can be put on the product. It can be put on the product. And the list is updated regularly. The companies have to resubmit every 5 years because maybe they changed the formulations of their treat that had the VOHC seal. So that's a guideline. But here's something really easy, and we're going to talk about dogs. There's a lot of things that hurt dogs' teeth. And I think I gave a list of some. Many of them are natural. So I'm just going to give you a short list of things that break teeth. They keep me in business, but I don't need to see broken teeth to keep me in business. Real, natural meat bones. Cooked or raw, it doesn't matter. The most common thing that breaks teeth. Hard plastic toys. A jolly ball would be an example. Hooves, like cattle hooves. Nylon bones, any brand, nylon bones. Antlers. And they're marketed as something that dogs like. They do like them, but they break their teeth. As a matter of fact, the UK took them out of the pet shops because of all the damaged teeth.
Wow.
So I'm often asked, well, why don't the US stores take them out of the pet shops? Because people keep buying them, so buyer beware. And last but not least, tennis balls. So they don't break teeth, but the fuzz is like a nail file or an emery board. It's very, very coarse. If you throw the ball, now here in Florida we have a lot of sand. You throw the ball, it's wet. The sand sticks to that fuzz and wears down those teeth, and we can never get the teeth back. So if you're using a tennis ball, wash it off, but I really prefer you to use a ball without the fuzz. It's all about the fuzz. And how many dogs love tennis balls?
Yeah, Dr. Hoffman, you're going to have to break that to Libby, our golden retriever.
See, it's hard. It's hard.
Very well.
No fuzz. Same size ball is fine. So here's another rule of thumb. When you're in the pet shop or you're somewhere you want to buy a new treat, because guess what? The dog just destroyed the last one. The rule of thumb is if you can bend it with your hands, thumbs up. If you take your fingernail and you can make an indentation in that shoe, thumbs up. If you can't bend it, or the dog's going to chew it's going to be a little softer, that's okay. And you can't make the indentation, thumbs down. Literally, the rule of thumb, okay? Thumb, indentation, thumbs up, and thumbs down.
Seriously, I'm going to have to clean out her whole toy basket.
So here's the other question I get very frequently. A pet will come in that's a big dog, very strong jaws, think pit bull, Rottweiler, and they love to chew. They chew 24/7, which is, gets a little obsessive. And they go through so many toys. And the owner says, I want the toy the dog cannot destruct. I say, that's fine. They're out there, but they will destruct the teeth.
Oh.
The toy that is indestructible will destruct the teeth. And then you're seeing me for a root canal or extractions. So, and those dogs need more activity. Give them a job, and they won't chew 24/7.
Yeah, true. Well, speaking of chewing, Janet and I both have rescues, and some of these rescues, thankfully ours don't, but some of these rescues that I help out with the rescue groups here, they're just, you can tell they tried to chew out of the cage.
Yes.
Oh.
And so are those repairable when they take them down, those incisors? I mean, sometimes I guess I can see the pulp. I don't know. I'm not,
Right.
versed in it like you are.
So that's very, very common. You're talking about wear on the teeth, not so much a fracture, but wear. They wear down the incisors or the small teeth in the front, and dogs and cats have 12. People only have 8. And then the canine teeth, the big long ones, they can wear the backs of those down if they're chewing on a cage, a kennel, a fence. Very common in dogs with separation anxiety, and believe it or not, in the police dogs. We can do something to protect the canine teeth from further wear. I can put metal crowns on them before they break. Once they break, you need a root canal before we can put a metal crown. The incisors in the front, we don't crown those. And sometimes the pulp is exposed and sometimes it's not. The only way to know if the tooth is dead is to have x-rays, because you can't save the dead tooth unless you're doing a root canal. Tennis balls will wear down those front teeth all the way to the gum line. So it depends on the tooth and how far the damage is, whether it can be protected from further wear. So in our military dogs, the ones that are going, they're being deployed with the soldiers, they need their teeth. And the police dogs, they need their teeth. So that's something that we try to save the teeth, the big 8 teeth on those dogs.
What about rock chewers? You know how a lot of Labrador retrievers will chew rocks? You see a lot of broken teeth from that?
They also swallow them.
Yeah, well, that's another surgery talk. Yeah,
that's another surgery.
Yeah.
So that's another. They're selecting something. Labradors, I think there's even a study on Labrador retrievers about why they even swallow the things they do, including knives. I mean, you and I know they swallow a lot of non-food items, and they're trying to figure out the satiety in the Labrador retrievers. So I don't see a lot of rock chewers with broken teeth.
Oh,
I'm sure they're out there, but probably the primary care doctor is seeing those. Yeah.
And again, like you mentioned earlier, those dogs need a job.
They need a job. They're bored.
They're sitting there. Yeah, they're bored. What about, I've seen some of, I don't want to mention any brands, but I've seen some wipes for teeth.
Yes.
And wipes versus brushing versus the finger brush. What's the deal with wipes? Are those effective?
I actually recommend them for people that don't want to brush.
I bought, okay, I'm going to tell you, I bought Vetradent wipes. Okay. And I wipe Gidget's from China. She's a China Rescue Golden. Wow. And she came to me at a year of age with bad over 4th premolars. I mean, they're worse than stained. And so I thought, well, I'm trying out that. But I really wondered if that was effective, if that's an option, the wipes.
So people, we brush our teeth twice a day, once a day. Some of us floss. Believe it or not, it's fewer than 10% of us. Shame on us. And if we don't brush every day, in 4 days, the plaque, which is the gooey stuff and the stinky stuff, becomes mineralized from minerals in the saliva and becomes calculus or tartar. At that point, you can't wipe it off. You can't brush it off. So it really depends on where you're starting with the wipes. The best time to use a wipe is after the teeth have been cleaned and polished.
Okay.
Not right after extractions, because things are still healing. But they're not going to wipe off anything that's hard. And when I clean teeth, I don't usually just clean teeth. I usually do a lot of other things, unless the patient is a high anesthesia risk. Then they come to me because I have the anesthesiologist. But I tell people, don't even try to wipe or brush until we eliminate the pain. Because if you try to wipe and there's something painful in there, the pet's going to associate the wiping with the pain. It's not going to let you in there.
Hey, did you know that for dogs and cats that could benefit from a prescription diet, Blue Buffalo offers natural veterinary diets formulated by animal nutritionists and veterinarians for certain dietary needs like kidney support, weight management, gastrointestinal support, and my particular favorite, dermatology. They make a food allergic diet that's an alligator-based called NP or a hydrolyzed salmon base for dogs and cats called HF. Contact your veterinarian about these prescription Blue Buffalo diets. So in people that do want to brush their dog's teeth, is it essential to do it every day
It is.
as opposed to just once in a while?
It is.
Oh.
It's so funny because I'll see some patients every 6 months. So people, and I know that some of our listeners will understand this, people get gum disease, which is periodontal disease, the big long word, but they have to go to a hygienist every 3 months to get cleanings underneath the gum line. So it's very interesting. If I have a periodontal or gum disease patient, I want to see them every 6 months. We cannot cure this disease. Same in people. We can only control it. And it's the biggest cause of tooth loss in people and our small breed dogs. So they'll come into me for the 6-month follow-up after we've done a periodontal treatment. I'll say, how's the brushing going? Oh, it's going okay. I said, how often are you doing it? Oh, it's like a confessional. And there's this guilt because it's not as often as it needs to be to help the pet. I say, that's okay. I just want to know what's happening. Because guess what? If the pet is unwilling to allow the person to wipe or brush, we have to find something else for them to chew or drink. And that's where I give the little handout about the vohc.org website to find what is proven with evidence to be effective. So we're going to customize the dental home hygiene with the realization about what should we expect? What should we expect if we're not doing anything at home? Because when you and I go to the dentist every 6 months, if we do, we're doing something in between those every 6 months. We're not waiting for the next visit. So it's important to have realistic expectations.
Wow. So when you do a crown, is it like you do the whatever the work to prepare the tooth, then they get the crown right away when they're at first appointment?
No,
That's surgery.
no. The crown, many of us have crowns. I mean, probably our listeners are going to have crowns. When a pet comes in and sees me and I see a broken tooth, and the owner's desire or the policeman's desire or the soldier's desire is to save that tooth, if the tooth is dead and I have enough of the root left, the first step is a root canal. And at the time of the root canal, I shape the tooth for a crown. I make an impression and send the impression to the lab. The lab sends me back that beautiful new crown, and then I cement it on. So it's three procedures. The consultation, this is what I see. These are your options. Which would you like? Now let's schedule it. So it's a multi-step procedure. Yeah.
Wow.
Does the same lab that does human crowns do veterinary?
I used to use a human lab. Someone that did for people. And he was in South Florida. I went to visit. He says, I want to do this for you. And he was excellent. He was excellent, but he retired. So there are human dentistry labs that are doing some of this for many of the veterinary dentists in the country. There's 200 of us now in the U.S. And there are some just pet-specific ones. So, yes.
Oh, that's cool.
Yeah.
So you're I would think a proponent of dry hard food for pets.
No.
So it doesn't. It is that a fallacy?
It is.
Oh, good. See, this is why you're on. Good to know.
I like to
except
dispel myths.
for our producers.
Yeah, I like to dispel them. So that's what we were taught, right? So I can actually say, Alice, that you and I went to vet school in the last century. We can say that.
We did.
We did. And we were taught dry food is better. It keeps the teeth cleaner. Don't give the wet food. It's all gone out the door. Think about this. Think about chewing on a Cheerio yourself, a Cheerio. It crumbles, it breaks. It does nothing to clean your teeth. It's the same thing with dry dog food. They bite the kibble, it breaks, it does nothing to clean the teeth. The difference between a dental diet, and there are many of them now, and just dry kibble is the texture. They've got to chew. The texture of that food makes them chew, and it's pushing off the calculus. And so some of the chews in the vohc.org website also do that. They've got to chew it, kind of like a chewing gum. They sometimes tell people, chew gum after you eat if you can't brush. Right. So it's the texture, and it's not just the dry food kibble.
Wow, interesting.
Do canines ever get braces?
Yes. We rarely, it's rare. I remember one little terrier that came into me from the Panhandle 6 hours away beautiful border terrier, cute little dogs. And she had a lot of teeth in wrong places, and the owner wanted this corrected instead of having the teeth pulled out. She was a puppy. And so I have to select the owner. How willing are you to do this, that, and the other? You're 6 hours away. I can't help you on a weekend if something happens. And this is, it doesn't take years in a dog. It takes weeks, sometimes just weeks to move teeth. And I did put buttons and chains on that dog, and we moved the teeth. And she has a smile that's not painful.
Oh,
Oh my
Peter.
And so we can
gosh.
move teeth in younger dogs. Sometimes it doesn't require buttons and chains. Sometimes just a splint. We can even do removable devices with a ball to help move things out. So yes, we can move them so they don't have. The whole idea is not to make a beautiful smile. This is not a fashion show. This is to alleviate and prevent pain.
Wow.
Yeah,
And owners should not use human toothpaste on their
very good.
pets, correct?
And do you know why they
Okay.
shouldn't use human toothpaste?
Fluoride?
Very good. So we have fluoride in our toothpaste, and we spit. Unless you can teach your dog or cat to spit, they're going to swallow the fluoride, and we don't want them to do that. So the toothpaste is, the toothpaste companies have done very well to make it tasty like a treat. And sometimes that's how I teach toothbrushing. You give them just the treat out of the toothpaste, they'll lick it. I have cats that
I
lick the whole
saw
tube of
in your
toothpaste.
cat video. Yes, the
Yes,
cat loved it.
yes,
Yeah.
it's a treat. And then you brush. They don't understand why it's on the brush. And then you give them some more. So it's a good experience. Yeah.
Wow.
You know, Janet, Sharon and I were talking about there's some interesting diseases where, and she could probably tell you better than I, but that where when a cat has retained its deciduous, its baby teeth,
Mhm.
they can actually break their associated with a broken kneecap.
Their teeth are associated with the
Yeah,
kneecap?
and for short, they call it teeth and knees syndrome. Teeth and knees. And it's interesting. And it's rare. I have read about
Yeah.
it. I know an oral surgeon that saw one. He saw it for the knee. He wasn't an oral surgeon. He was an orthopedic surgeon. Saw it for the knees and didn't know about the teeth because guess what? We're kind of a different specialty. But the mouth is really connected to the health of the whole body. It's really connected to the health of the whole body, and we can't separate it. And as veterinarians, Alice, we're kind of lucky because we had to learn all the body systems, the skin, the mouth, the heart. And when people go to medical school to be doctors for people, they don't learn about the mouth. And they go to dental school to learn about the mouth. They don't know about all the rest of the stuff that we need for anesthesia. So
Yeah.
we're kind of at an advantage. The disadvantage is we don't learn dentistry for 4 years in vet school.
Right.
It's something we
Right.
have to do later if we want to really specialize in that.
Wow.
When you're doing a dental under sedation and you see some gum pathology, have you ever been unfortunately surprised, like squamous cell carcinoma, or do you kind of know when you're going in there what you're going to see?
Well, first there's a consultation in the exam room, and the patient's awake. Now, some patients are so painful, I can't do a good exam. So there's many surprises. I'll get,
Okay.
especially the ones that didn't even let me look in the exam room because they were in such pain.
Oh,
So they're
so
under
sad.
anesthesia. Now I get a look, and then we take x-rays, and there's even more surprises. So we do see cancers. In cats, it's more likely at the age of 10 and older, but sometimes younger, but more likely 10 and older. In dogs, we can see it in many ages. Also, all different kinds of cancers: melanoma, fibrosarcoma, squamous cell carcinoma. Some of them need surgery. Some of them is inoperable by the time we diagnose it. Yeah, but we do surgeries where we have to sometimes remove the tumor or part of the jaw. And dogs and cats can live for years if we get all of that out of there.
So when, they have puppy
Yes,
teeth, right?
yes.
And they fall out and all of a sudden, are there issues that that pet owners should look for when those puppy teeth are coming out? Like, is there something, a red flag or?
So that's good because they need to be looking. And the whole thing with
Yeah.
looking in the pet's mouth, remember we said don't open the mouth, just lift the lip. Get them used to being in there. Sometimes all of the baby teeth don't fall out and adult teeth start coming in where the baby teeth are still there. And there should never be two teeth in the same place at the same time. Some
Right.
people refer to this as shark teeth because it looks like the dog has 80 teeth in there. But so they want to look. And usually puppies and kittens are seeing the veterinarian every few weeks for puppy and kitten shots, and they're looking as well. So all the adult teeth in cats and dogs should be in by 6 months of age. And if they're not in, or they're in the place of a baby tooth, the baby teeth need to be taken out probably at the time of the spay and neuter, if it's being done at 6 months. Some are being done much earlier now.
So our son had his baby teeth, 8 of them were ankylosed to the
To the bone.
second tooth, the real teeth, and he had to have major dental surgery to take them out, and then they put spacers behind his teeth. So he essentially had braces so you couldn't see.
Yeah.
Because they were behind, and everything worked out. But it was really something when they took 8 of those teeth out.
That's a lot at one time. Yeah.
Mm-hmm.
Yeah. And he was actually, they did it in the hospital because I didn't want to have the anesthesia in the office.
But
But
you
isn't
wanted
it hard?
anesthesia for him. Absolutely.
Oh, yeah.
Yeah.
And then the funny thing is, my father-in-law, who's now passed, came to visit, and he brought my son that little Whitman's chocolate box.
Uh-huh.
So my son is like stoned, right? And what do you think he eats? A caramel.
Oh,
And we're sort of like, and
yikes.
we still talk about it. He then proceeded to throw up. The ghost.
Okay.
Like, oh,
It's like yesterday. He's probably 20 now, right? So it's like yesterday.
he is. He's almost 30. But
So I
we
have,
still
I have just something to share about a senior patient. And it was
Yeah.
it was a 17-year-old dachshund that came in. And this little
Wow.
dachshund belonged to a very fearful pet owner that had put off having dentistry for this dachshund for 17 years. And this dog had a lot of pain, a lot of loose teeth, a lot of odor. And what happens when we start having disease in the top teeth in dogs, especially the canine teeth? The bone is destroyed to the extent there's now no bone between the tooth roots and the nose, and the dog
Right.
sneezes. This dog had all of that.
Oh my gosh.
But we had to get her over the anesthesia hump. I get it. She even brought a emotional support human with her. Good for her. And I talked to her about anesthesia. And they always want to know, well, what happens if we don't do anything, right? What happens if we don't do anything? I said, well, what happens in these small breed dogs, as more and more bone is lost, sometimes the bottom jaw, left or right, will break. It'll fracture because
There's not much left.
there's not much left, and it is not uncommon for me to see that because of the fear of anesthesia. So we had the anesthesiologist, and we took a lot of teeth out of this dog. I had to do a plastic surgery on this side and this side to close the holes that went from the mouth to the nose. One hole was so big my finger went all the way up into the nose. And I will tell you, this dog lived without pain for the rest of his life. When the owner came back at 4 weeks post-op, she was a new person about the anesthesia. She is now an advocate for dental care for pets. The dog was 17. So we're not going to increase the length of his life, but he's going to live without pain.
Wow. How can you tell when your dog's in pain? Like, I know my friend now has a very old lab and she pants. It's like a quick, rapid pant. And that's how she can tell. Well, that's what her vet told her, that that's a sign of pain. And she also does, this thing where they go paw to paw, like almost like tapping.
So the interesting thing is finding out what's painful. Is it the joints? Is it the mouth?
It's the
Is there a
joints.
broken tooth?
Yeah, it's the joints.
The
Well,
joints.
It's
Yeah.
it's pretty bad.
Because
Yeah.
sometimes
and now her her hips are really bad, but now the dog, you can actually see the spine
the muscles.
because it's
Muscle
so
atrophy. Yeah.
it's atrophied. That just happened like in the last couple of weeks. I just saw it today.
Yeah. And it's about managing pain. I mean,
Yeah.
it's different than so the pet won't be active if they're in pain, whatever part of the body. They just want to be still. That's the acting old behavior. If it's in the mouth, it's the same thing. But if there's a broken tooth, we talked about not wanting to chew on that side, dropping food, avoiding their favorite toys. It's just too painful.
Yeah.
And so we can prevent pain. We can treat pain. And now we have all these anesthesia advances that allows us to do it safely. I think the oldest patient I had was 21 years old. It was a cat.
Dog or cat?
It was a cat.
Cat.
It was a cat.
Cat.
I think the oldest dog was 19. It was a pug, which are higher risk of anesthesia. Belonged to the anesthesiologist.
Like,
I've had some other patients that weren't pets. They've been whales and dolphins and sea lions, but they're not pets. But guess what? They all have tooth problems that cause pain.
Yeah.
Yeah,
so when you put the whale or the dolphin
yeah.
under on general anesthesia, are they in the
They're
water?
actually not under general. I have to do locals, and they're trained. They're trained to allow me in their mouth. Isn't that amazing?
So are you like in a swimsuit there? I mean, like, how does that work?
I don't know how much off the
Have
pet
both?
off the pet trail you want to get, but it's the dolphins are lifted out of the water and put on like a foam mattress for me, but they can only be out so long. Um,
Mm. What kind of problems do they have? Do they have impacted teeth or infected
they can
teeth
break
or
teeth. They have
break?
toys
Okay.
to play with, and some of them
Oh.
break teeth. So we take care of them. They're being taken care of.
Mm-hmm.
Yeah,
Are they sweet? Are they nice? Are they?
some of them are. Some of them are.
Do
Looks
they
like
what do they
when
have
an animal gets.
incisors? What kind of teeth do they have? Canines? I don't even
Ah,
know what
good
kind of.
question.
Yeah.
Anatomy question. So
Yeah.
whales and dolphins are pretty much the same. They're cetaceans. We're not talking about the baleen whales and those things. They only have one shape of a tooth. It has one point. They only get one set of teeth throughout their life. So it's quite different. So whatever species I'm working on, I have to know about the anatomy of the tooth above and
Mm-hmm.
below the gum line. And for that, I go to museums and study skulls. Yeah.
Wow,
Interesting.
that's
What's the
fascinating.
status on, say that, for example, that 17-year-old dachshund
Yeah.
with the bad mouth? Do you do pre-surge antibiotics, or is that not done anymore?
That's a very good
Pre and
question
post?
because we used to think that all these dentistry patients need antibiotics, the same in
Mm-hmm.
people. And we have
Mm-hmm.
found that in people, there's an over prescription of antibiotics, which, as you know, there's a global problem now, people and our pets, where there's antibiotic resistance. So there are very, very few situations in which we even prescribe antibiotics at all for our patients. And if we do give it maybe a single injection a couple hours before the procedure, if it's a surgery, because then the antibiotic is in the bloodstream. But we rarely dispense it anymore. Even patients with heart disease, um, we just don't. We know that it's not effective, and it's contributing to the antibiotic resistance global problem.
Well, Dr. Hoffman, we have to ask you a question that we ask every one of our
Oh,
guests, but you've already listened to one of our things. So, what is your pet or human peeve?
oh my goodness.
Like, what just bugs
Well,
you?
that's so different between pet and humans. I think people need to spend more time being kind to one another.
Oh.
You know,
Amen. Amen.
whether it's
And understanding. Yes.
just kind. Give everybody a little bit of grace. Maybe they're having a bad day. You said
Mhm.
the car thing. Well, what if they're honking their horn? Or we just need to be a little kinder. And for that, we have to press the pause button. We just have to press the pause button, and we're all in a hurry. So the pet peeve, um, maybe just some of these myths. Some of these myths we're debunking today, and the misconceptions. They're still being taught and they're still being followed. And it's education. I love to educate in the exam room, at the veterinary school, because it's eye opening. And you've given me a chance to do that today.
Yeah.
Well,
And
and
that's
that's kind
the
of why
point of the
Janet and I
podcast.
started this,
Yeah.
to
Yeah.
correct the misinformation. Look at how many pets suffer from adverse effects from misinformation.
Or fear. I don't get to treat the pet.
Right.
Yeah.
Well, and I have to say, I think social media is responsible for a lot of that.
Oh, sure.
Average Joe is out there saying, give your dog a cabbage,
Yeah. Yeah.
and you see the cute dog peeling off the leaves of the cabbage. And I'm like, that can't be that good for that dog to eat that entire
Well,
cabbage.
now we know about tennis balls, Janet.
Oh my gosh, you know what? She's going to need counseling.
We have behavior specialists.
That's right, we do.
Well, actually, she likes lacrosse balls.
Uh-huh. How
I don't
hard are
know what
those? Can you
those.
put your fingernail in there?
Oh,
I don't think so.
Okay.
I got to
So
go
remember
try.
the
is that
rule
like
of
a wiffle ball?
the thumbnail rule.
Oh no, the wiffle ball, Al. She gets her teeth in the holes.
Well,
And
wiffle ball wouldn't be good according to Dr. Hoffman because you
no,
can't.
it'd be terrible. I can't give her a wiffle ball.
Yeah.
I have to find a ball that I can put my fingernail in.
So let's talk about some other things that are good that the
Yes.
police dogs are getting and the military dogs. You may
Okay.
have heard of, well, it's called GoNut, like donut, but it's a G. and you can
Oh.
Google Goughnut, Goughnut. They can't destroy it. The police dogs and military
Okay.
dogs are not destroying it. It doesn't taste good, but it's something that's not going to hurt their teeth.
Okay.
And there's some other ones. So they're kind of a rubber. It's not a hard plastic. Whenever there's a toy that has a hole in it, I think the wiffle ball does, you need to make
Yeah.
sure they can't get their tongue stuck in it, because then the tongue will swell. And guess what? Sometimes
Oh,
that means an amputation of the tongue.
oh my
Oh
God.
my God.
Yes. So things we don't even
That's
think
true.
about can damage
Yeah.
the gums, the tongue. Um, sticks can get stuck in the top of the
Oh,
mouth between the two upper fourth premolars.
I've had that
Yep.
happen. I've had that
Yep.
happen. An average non-vet got that thing out with
Yep.
pliers. It was
So
terrifying.
that's another reason to look in the mouth. That will often cause drooling. That's one of the things. But
Yeah.
not, a dog can have that in there for months and cause
Yeah,
permanent
well,
damage to the,
like
yeah,
this,
yeah.
like trying to get in there. What about
Kongs
Kongs?
are good. Kongs are good. But remember, some of them have the holes. And sometimes they say put peanut butter in there. Well, yeah, but make sure that the tongue can't get in there and get stuck. So just be
Right.
careful of things with holes in there.
We have another one that's like dome shaped and the underside, soft rubber. The underside has like a cut in it. And I can put a pretty big square treat in there. And that's a big hit with her.
Good.
And I can get my thing, I can poke that with my nail so it's soft
Good.
enough.
So you know what to do. It's easy already.
I do. This has been incredible. Poor Libby, though. She's going to, woo-hoo.
They love the balls, but just not the fuzz. Not the fuzz.
I have a question about your photography.
Yeah.
I did look at your website, and the ones with the driftwood, was that beach is it by Amelia
Yes, it
Island?
is. Yes, it is.
I've
Oh.
been there. We got up at 4:00 in
Yeah.
the morning to meet the sunrise, and we thought we were nuts. And my son and my husband and I, we all went, and this woman was out at the beach. She goes, "Go another mile. It gets better." And it's like barely 5 a.m. and we're walking, and it was phenomenal. It's
Wow.
beautiful. It's really something to see all that driftwood, and it was magical.
It is magical, and that's what I do when I'm not in the OR. I'm out there at the beach making magic.
The producers put links to all of that and all the information that with all the websites that Dr. Hoffman mentioned today. So helpful. I mean, I'm just going to go through those toy baskets right now, Janet.
Oh my gosh, this has been so helpful.
Yeah.
Thank you
Thank
so much,
you.
and thank you for the good work you do to give
I
back.
know
That's
our
incredible.
viewers got so much information, and that's the whole reason we're doing this.
Great.
So we can't thank you enough. Well, Janet, what do you say? Should we
Well,
wrap it
don't
up?
forget to like, review, and share. Speaking of
that's right.
Pets podcast, we appreciate that. We love those up thumbs.
Yeah.
Thank you so much.
Yeah. Thank you, everyone. Have a great day. Kiss the pets for us and check their mouths.
Bye from the Novotny sisters. Thank you, Dr.
You're
Hoffman.
welcome.
Thanks, Dr. Hoffman. Hey, thanks for tuning in today. We hope you found the science-based information provided helpful in taking care of your pet. Check out our other Speaking of Pets episodes wherever you get your podcasts.
We'd love to hear from you. So email your pet photos and or pet peeves to contact@speakingofpetspod.com. Remember to follow Speaking of Pets on all social media.